out of town today, which is unusual, but we only have one item on the agenda, so I think we can handle it. Who's going to be presenting for the administration? Mr. Merriman? All right. All right. I'd like to call to order the Cuyahoga County Health and Human Services and Aging Committee meeting for Wednesday, November 19th. And clerk, would you please call the roll?
Calling the roll, Mr. Brady.
Present.
Ms. Conwell. Ms. Conwell is absent. Mr. Jones.
Here.
Mr. Greenspan. Mr. Greenspan is absent. Mr. Miller. Here. We have a quorum.
All right. Is there any public comment related to the agenda?
No, Mr. Chair. No one has signed in.
I thought the room looked pretty empty. We'll need to do a little housekeeping. I'd like to approve the minutes from the 1st of October, which shows you how seldom this committee's been meeting recently. If I could have a motion for the minutes.
Second.
Moved by Councilman Miller and seconded by Councilman Jones, and that just about is the entire committee. So all those in favor of approving the minutes, please say aye.
Aye.
Aye. All right, we have one resolution in front of the committee today. And clerk, would you please read the resolution? And we have Mr. Merriman to present for the administration.
Resolution 2014-0275, a resolution making an award on requisition number 31067 to United Way Services of Greater Cleveland in the amount not to exceed $1,095,450 for fiscal agent services for emergency food purchases for Cuyahoga County residents for the period 1/1/2015 through 12/31/2015, authorizing the county executive to execute the contract and all other documents consistent with said award and this resolution, and declaring the necessity that this resolution become immediately effective.
You know, when I was in the Cleveland City Council and chaired the Utilities Committee meeting, and the chairman used to read the language of the resolution themselves. Well, there were 21 councilmen, and it was, you know, apparently probably not enough clerks to do that. So then when I went to Columbus, I was in the minority, you know, for a decade. So when I first came back here, when we first started having these meetings 4 years ago, I started reading the resolutions just like I had left the council 10 years earlier or longer. So, but it didn't take me too long to get straightened out. So, Mr. Merriman.
Good afternoon. David Merriman, Administrator of Cuyahoga Job and Family Services. I'm here today on an item, a contract with United Way Services of Greater Cleveland for $1 million, and we are looking to, it's actually $1,095,000. We're looking for council support to extend our emergency food assistance program. Council's well aware of this program. We've done it every year in one form or another over the past 4 years, although at one point we did switch the provider from the food bank to United Way. And the contract, excuse me, before you today looks is only different from those previous years in that we went ahead for the next year and extended beyond our final amendment period. You'll recall when we initially executed the contract with United Way, we had 2 amendments written into it. And so I'd just like to acknowledge that we did have the opportunity to put this contract out to bid in 2014 for 2015 services. But given the change that has gone on in this community over the past year, largely directed by the state and their decision to increase the requirements for individuals that get food assistance but don't have children, the ABODs, we felt this was not the appropriate time for us to change the network, change the system. We wanted to provide at least another year of stability and then allow for maybe a strategic review of this contract and this partnership in the future. So we did ask the Contracts and Purchasing Board for an RFP exemption to continue to provide this service with this partnership and we're granted that. And so we're before you here yet again requesting your support. This is clearly one of the most important services in the county because it is basic needs. It is tons and tons of food the county residents will eat. And we provided over 15 million pounds of food through this contract, and food is charged to us at a rate of 20 cents per pound. Over 42 centers provide, or at least 42 centers distribute this food, and they serve literally hundreds of thousands of participants, families and children and seniors. And again, it is a partnership. We provide the contract and the funding to the United Way agency. United Way also manages FEMA programming and dollars. So we feel like this is still a very viable model of having one entity manage emergency food assistance for multiple programs. United Way works directly with the Cleveland Food Bank to purchase the food. Cleveland Food Bank distributes the food to the Hunger Network sites. In my mind, it's probably a model worth exploring nationally.
Right.
And it is a model that has worked well. So we're here yet again before you with yet another contract extending the program for an additional year, and then just recognizing that the next administration, as well as this council, will have the opportunity to ask questions yet again next year. Is this the right model and strategy?
Very good. I guess it was about a year ago that we were challenged by the change in state regulations regarding the distribution of these food sources. Have you been able to draw any initial conclusions about what the result has been?
Yes, we have had over 10,000 single adults leave our program and are no longer eligible for food assistance because of their non-compliance with the new regulations. I'll share with you, I thought had significant efforts to reach every single person. We did multiple phone calls, we mailed, and we really tried to get the word out there. We need to meet with every single person that's receiving food assistance, reassess their application. If they are not exempted from that requirement, work with them to find an appropriate work activity so they can continue to receive benefits. And over 10,000 individuals did not follow up with that obligation, and we were required
10,000 down from how many?
So there was over 29,000 ABODs. Excuse me for using the acronym of an able-bodied.
Yeah, but for the able-bodied.
It's an able-bodied adult. So it's an adult without dependents or disabilities.
Okay, all right. So a third.
Yes.
A third opted out.
I actually had a conversation with Case Western Reserve University, Claudia Coulton, and I was recently asking her, it's been 10 years since welfare reform happened. What happened to the thousands of families that left our system then? Because I'm asking the same question now. What's happened to this 10,000 individuals? Where have they gone? I'd like to hope they've gotten jobs, but if they didn't have a job before, then I think that's a question that we can only ask. We can't answer. And so I'm still interested in getting the answer to what happens when 10,000 people suddenly lose benefits because of a state decision that really has an immediate impact on families and communities.
Has anybody heard any feedback from any of the folks that in the nonprofits who try to track things like this?
So we work closely with the homeless service providers. We continue to serve individuals through those programs, and I think they're well aware that as we terminate people's food assistance, if they are homeless, they're still in that system. So the door remains open for them to come back to us and work with us. But as it relates to the Hunger Network, we know that they and the food bank, we know they continue to see increases in demand for their assistance. And whether or not that is directly related to this or it's related to poverty and changing economic status, they may not be able to differentiate. But we know the demand is there, hence the importance of this contract.
Do you, final question for me, and then I'll open it up to the entire committee, meaning the other two councilmen. Um, The, what is the administrative cost for this program, this million,
$25,000.
25,000? Mm-hmm. Okay, questions by committee? Councilman Jones?
Okay, and just so I'm clear, the 29,000 that were originally identified, you were able to process each one of them and determine that there were only 10,000 who were removed?
No, there 29,000 were reviewed. We looked at their profile. We understood whether or not we were already aware if they were exempt. So if they were listed in our system as being within the age, but we actually determined they were outside the age and maybe exempt for this service, or they had children, maybe that moves them to another group. So we assessed 29,000 and began contacting them. A number of the 29,000 were in fact exempt. And those that weren't exempt, we contacted and said, we need you to come in to do your annual redetermination and see if in fact there aren't exemptions that we're not aware of, or assign you to an activity, or understand maybe now you are working part-time and that meets your obligation. And we've removed over 10,000 individuals as a result of either doing that assessment or them not following up with the obligation to come in to be assessed or to meet the expectations of the program.
So after reviewing and assessing 29,000, you determined, I guess, 19,000 is the difference between 10 and 19 were determined to be exempt, and meaning they were able to retain their benefits.
Yes, I'll send you the triage log
Okay.
with our most recent numbers showing how many left the program in the past year.
So that 29,000 came down to 10,000 who were still without benefits, without,
Who we removed from the program,
Removed
and
from
then
the
the other
program.
19,000, and new people come in and people come off for other reasons. So please don't understand that all of these are related just to the administrative review, but over 10,000 people that started last year did not start this year with benefits.
okay. So now of those 10,000, well, let me ask this. I asked the question originally when this problem was presented, Thanksgiving of last year, really.
Yeah.
Right before Thanksgiving. I said, what if someone starts a business? Would that serve as an opportunity to retain their benefits? And I remember Joe Gauntner and the team determined the answer was yes.
Yes.
They forwarded the paperwork to me and said if there was a self-employed box that could be checked off, and they would, and along with receipts for the business, they could retain their benefits. Can you share with me, if you know at this moment, if any of those exemptions were used? Did anyone check off self-employed at any point?
I don't have that information at this time. I would be happy to go back and ask our staff to look into it. It so happens right now we're working on a federal grant application, largely targeting this issue. It's actually looking at individuals that are receiving emergent SNAP, supplementary nutrition assistance, and don't have a high school diploma and are working. Could we provide them other services to get them their diploma and maybe get a better job? And so at this time, we're actually looking at data. And so just today we were talking about, can we differentiate who is working and has paid employment, who is self-employed, who has an arrangement maybe with a church or with something else, or with a landlord that in exchange for me doing yard work, you rent me a room or something like that. And so we're looking at this exact issue, and what staff were telling me today, this all comes down to coding, and how have we coded each of those work activities. So I will ask how many of the universe are listing self-employment.
And again, I see this as an opportunity.
Yeah.
I see it as an opportunity. If there are 10,000 or whatever that number might be, there's probably a chance to partner with workforce development. Sitting on the Economic Development Committee, we have a 5-year plan, as you know, and one of those planks is a partner or a collaboration between the Development Department and other county departments. So Economic Development and or Department of Development and Human Services could partner. You have the data, you have the individuals, and workforce development certainly could train people around a chosen entrepreneurial endeavor. Whatever collaboratives come from that, that is an opportunity. I can wrap my mind around a 5-year plan to help 29,000 individuals. That's not as nebulous as some of the other things.
And some of the 29,000 are working now. Some are self-employed. I think there are some that just aren't. And that's my interest. One of my interests is to find out why people aren't working and to help them. The other is to find people that are working and get them in a position to make more money and get a better job. I will tell you the grant that I was just referencing, it is a required partnership between us and workforce development. So I've actually essentially asked Grace Kilbane and Jay and the rest of the WIB board staff to take the lead on crafting the model, crafting the idea that really the federal government is looking for in terms of innovation. And I'm following their lead on it largely, and we're going to access their network, strengthen the partnership between us and them, and hopefully find yet another strategy to move people from either no employment or marginal employment to better employment. Maybe address their lack of a high school diploma or a GED. Maybe get them a certificate so they can do their own business, or they can work within a business. So that's actually the proposal that we're working on today.
Okay, so I'll share with you a few anecdotal stories just as a constituent calls. My first 3 years, I would talk to constituents, and I've learned not to sit on the phone for an hour with someone, but in that first year, I listened to every story they tell, and it was always around the fact that they were losing benefits. They didn't come out and say it, but they talked about the county and workers and how they felt they were mistreated by as they tried to get work training, or they were late for this or late for that. And after hours of conversations, I started to realize what they're really saying is my benefits got cut because of my lack of job training or attendance or whatever it might be, and I want my benefits back. And that's really what it was about. So I would get those type of calls. Last summer, after the cut to the SNAP, I met a gentleman at a safety fair in my district, and he said he wanted a job. And as he talked, he said he had been taken off the food stamp rolls. So when I heard that, I said, this is an actual person who's going through everything we're talking about. He was living with the family. And so I asked him the same question I asked you. Have you ever thought about starting your own business? And he said, yeah, I cut grass now and then. I said, well, if you do it as a hobby, why not do it as a business? We could help you navigate through and check off the self-employed box and maintain your benefits. I said, if you're really interested, call my office and we'll help walk you through it. So we did. We helped him. Levine Ross here, staff, she helped the gentleman. Haven't followed up with him yet. Well, we may check and see how he's doing if he chose to follow through. But there was one opportunity. He saw it as an opportunity. So if that works for him, I imagine something could be done, scaled up to the numbers that we're dealing with. So as I've said before, I look forward to working with you and administration around something, whatever that plan might be, to address that issue.
Councilman, I appreciate your advocacy in the community as well as your direction that individual should not take no for an answer and we should try to find a solution. I'd actually counter with a story. Recently, I took a call from an irate gentleman who was calling to ask me, why is it that people with benefits can take their card and buy filet mignon or steak? And I see them in the line in front of me, and can't you do something about it, Cuyahoga County? Can't you stop them from buying steak and lobster, whatever they want to buy? So I said, I think I know the answer. I'm going to research it. I'm going to get back to you. And I did. And I told him, this is a federal program. The benefits can be used for anything. And, a person has the choice. Now, I didn't get into this, and I said, maybe that person is throwing a dinner for For a spouse, maybe that person is throwing a dinner for their dad, and they're going to use a lot of their money for that purpose. Now, that's their choice, and it is that clear. Cuyahoga County does not choose what is a good thing to buy with the money or not. We make programs available for them to buy fresh fruits and vegetables. We support development of grocery stores so that people can buy good food in their community. But we don't tell them, you will buy this, you won't buy that. It just doesn't happen that way. So I explained that to him. After that part of the conversation, he says, well, I also got to tell you, I got a brother that recently got laid off, and he wants to know if he can get benefits. Now, I don't know. I'm going to take him at his word. And if he's telling me he's got a brother that is laid off and wants to know if he's got benefits, I told him, well, tell your brother to call us because he is eligible. And this benefit is for anyone, right? And he's a resident of this county, and he's probably eligible. Call us up. We'll take care of. We'll take a look at his case. Now, whether that was his brother or that was him, I don't know. And he thanked me for that information. He thanked me for that encouragement. And we ended our call. But I think that's the other half of the angry call. Sometimes we take these calls and we don't know. We don't know what they're calling about. But as you dig into it, you find out there's a lot more going on. And that's one of our challenges, is to dig deeper, find out what's really happening, what's the rest of the story, and how do we really change this call.
I guess I should ask another direct question. And I know you touched on it earlier, but what is the strategy for the 10,000 to address that? And you did say it, but maybe just succinctly.
To address it, there's a real challenge. If they were getting benefits for 3 months, and we don't have documentation that they were meeting their work requirement during that time, they owe us the hours for those periods before they can get benefits again. So as they come back into us and as we take another look at their cases, circumstances may change client to client, but we're going to say, before you can reestablish benefits, you're going to need to first go out and do some additional work activity to get you off sanction, and then you can start receiving benefits again. We've set up a lab just at the end of the street in the basement of Reserve Square. We have a computer lab that people can use for job search, job readiness. They can do GED programming there. They can do hours there. They have a recycling program. They break down materials and recycle them as a social enterprise. And so we can refer people literally down the street to make up their hours. But they got to come back in, and they have to re-engage us, and they have to achieve those hours before they can get benefits again. And at this point we continue to receive them coming back in, and we respond to them. But the primary strategy has not been to chase them down. A lot of the times, the reason they haven't come in is because we don't have an up-to-date address and an up-to-date phone number. So we have limited ability to connect with them. And we do rely on them to come to us. Even when we have a good address or a phone number, only about 60% of our scheduled appointments occur. People don't show. It's a challenging responsibility. You set appointments, and when folks don't show, you set another appointment. But after a certain time, if a person isn't showing, then we are required to process the application and most likely to terminate the benefit.
This problem was first brought to us, at least to this body, in November of last year. That's 12 months ago. When did you begin to implement this strategy?
It's immediate. We immediately started to do overtime.
You did the assessment.
Actually, you found out, I'm sorry, but you really found out at the last minute, right? I mean,
within a month. Within a month, they were saying
had almost no time to prepare.
And they could have given us a year, and they didn't. The state also extended that exemption for Appalachian communities. And they said these communities have such high poverty that we want to continue to allow these single adults to get the benefit without doing the additional work, but not for the balance of the state. And, many people question, how is that equitable? Now, I respect that poverty in Appalachia, Ohio is severe and significant, and so it is in no way against them getting the exemption. But around the rest of the state, we said, we have some pretty severe poverty up here too at times. And I think the state made the decision not to request the exemption And, really at this point, there's no going back on it. So it was to me a decision I still don't totally understand. They could have given us another year. There was no reason for them to make the about face at the time they did, and they did.
What are the, I mean, I know that you don't work for the administration in Columbus, but what do they think they've accomplished? I mean, from their point of view, what would you say that they think they've accomplished?
Yeah, I can only draw assumptions based on many of the other programs and policies that have come out, which largely focus on requiring that individuals do something to receive a benefit, or exploring how a benefit is tied to some sort of contribution that would ultimately lead to
I
self-sufficiency.
understand that. I mean, it's an easy thing to say.
Yeah.
It's just tied so much to everything else in society. Mental health, education, job training. What do we have? Full employment in this country ever? It just seems so easy, such an easy thing to say, with disregard to the realities
Absolutely.
that we live in. I don't know, Councilman.
Mr. Chairman, Chief, you mentioned that 15 million, was it 15 million meals or pounds of food were provided? Over what time period was that?
That is actually that is just for a portion of the period. That was actually during just the first 2 quarters of this was actually through 2012, so it's probably comparable amounts now. So just in 2 quarters, 15 million pounds of food.
Well, at 20 cents a pound, that would amount to 3 million. So where's the rest of the money coming from besides what's here?
So there is FEMA money. I know that that the food bank also, United Way also receives FEMA money and provides that to the community. And obviously, the food bank, they're going to layer in whatever other donations they provide to get to the hunger centers as well.
So it's a combination of sources.
Absolutely. Yes. Thank you.
Okay.
And let me also recognize, and it's through campaigns like Charity Choice and Harvest for Hunger. I think this community is famous for being very generous and having many campaigns where employers make contributions to organizations like the Food Bank and like the Hunger Network.
Chief, is the amount of need out there continuing to rise, or is it come down a little bit now that we're well past the 2009 recession and the economy seems to be at least a little bit better?
Councilman, if it's okay, I'd like to ask the same question of the food bank. The last conversation I had with them about this was probably close to a year ago, and they told me need was up. So at that time, they said the need was up, and but let me ask them the same question again and get an answer for you from them.
Okay.
Sure, of course.
Okay, I support the program and have no other questions.
I appreciate the work that was done by the work that was done by the staff. I think you all have in front of you the list of the 34 hunger centers. If you're interested in maybe holding on to that or knowing about that. And I guess the only question, the last question I would have is, is not that there's I don't know what the level of complaints or problems there are, but issues like the variety of the meat, the amount of fresh fruit, dairy items, how do we need to bring them in to talk about that, or would that be the best way to go about it?
Councilman, those are great questions, and I think it is difficult. I think we hear two different things. We hear that some individuals really value stable foods, canned foods, and other things. If all they have to heat it is a microwave, or they don't have a large refrigerator, then it's something stable is of great benefit. I think you also raise an important point about the health and the quality of food, and I think when you're paying 20 cents a pound, you're probably not getting a lot of protein, and with maybe the exception of eggs and some other food ingredients. So I think it's a fair question, and I would be happy to see if to follow up with you if you want to schedule the food bank to come in to talk about their strategy, what they buy. I know they're concerned about it as well. I think they're also concerned about just overall demand and getting as much food out to as many people as possible. So it's probably a tough call for them to make, and they make it routinely.
Well, I'm sure that this winter, will be a good time to have them back to discuss the program. Certainly, we're familiar with the program, and I know that the council as a whole, supports the program. Could I have a motion to move the resolution?
I make a motion that we move this resolution to the full council under second reading suspension.
Second.
Motion's been made and seconded. All those in favor say aye.
I have one other question.
Sure.
Who is your team that is
Just a second.
crafting and refining the decision, the strategy? Who are your collaborative partners, the team that's helping craft the strategy?
I'm sorry, did you say you wanted
No,
to do
no,
something?
no, that's okay. I'm not worried about it.
Okay. I'm sorry, your question, the team that crafts the strategy on.
You just shared.
Yeah, so we are a part of the FEMA board, and so there is a community group, and I know Sister Joanne Gross used to sit on it as well as Jim Boyle and others. And we do talk with United Way about what's the best way to ensure that these resources are provided in a coordinated fashion. So I think that is the board that I would think about. But I think at the end of the day, this is county money, and we set the we get input, right? But we make a decision about when we think it needs to be reprocured, or do we need to do something different.
Well, the resolution is adopted.
Thank you very much.
Under miscellaneous, I wish my vice chair was here at the time and Councilman Greenspan, but I think this, unless something happens that I don't expect, I think this will be the last meeting of the year for this committee. If something comes up that's not too major, we'll handle it, probably in the committee of the whole. We've only got a couple of meetings left to go, and we don't know of anything coming up. It's been a real honor to be able to chair this committee for the last 4 years, and we've learned a lot, and there had never been a Health and Human Service Committee of the county government in the past, and so we were inventing it as we went along. Been lots of visits to lots of sites and lots of information, and I think a lot more interaction by the council than there could have possibly been by only 3 commissioners anyway. Just physically, it's not possible. I guess the biggest thing we went through a lot, but what I'm really proud of is what we were able to do last year by not only supporting, not only passing a levy, but passing an increase in the levy, and 2 of the people who worked very hard on that levy are here at the table, and one of them who did is not the vice chair. Others all did, and I even it's certainly even definitely respect members who maybe live in communities that don't have as much need and whose constituents maybe not be as sympathetic, and perhaps the levy didn't even pass in their district, but were willing to unanimously help us put it on the ballot and say to anyone who asked that they supported it and why. And, so I guess that was probably our best moment in the last 4 years. So it's been a pleasure, and we'll start again in January. I don't know what the makeup of the committee will be. That is to be determined. But I'm sure since most of us are going to still be here, that there'll be some familiar faces. So thank you all. Anybody got anything?
Mr. Chair, I was only on this committee for the second of the two sessions, but certainly involved in the process throughout, and being the first county in the country to launch a Pay for Success project is also not a small accomplishment, and that legislation was handled in part through this committee. So
Point well
I
made.
raised that as well, and I think there's much in addition that we accomplished in this committee, and I commend you for your leadership.
Well, thank you. And we feel pretty good about it.
I'd like to do the
Councilman?
same, just commend you on your leadership. I've been on this committee from the beginning, from day one. So you have led us admirably over these last 3 years, from Metro Health to the visionary work in our Health and Human Service levy. So I have enjoyed this committee. I've learned a lot, and I appreciate all that you've given to this committee.
Well, thank you. Anybody else have any more praise for me?
We didn't give Rick a check, is he?
Mr. Chairman and members of the
Can't pay
committee,
everybody.
Rick Werner from the Office of Health and Human Services. I just wanted to thank the committee chair and the members of the committee and those that couldn't be here today. I think me and all of my colleagues are grateful for the thoughtful way that you guys have asked us questions, pushed back on things, really, I think, spoke very much like Councilman Jones was talking about a little while ago, for the needs of your constituents. I do think, as the chairman just said, having had the chance to work here under the county commissioners, that was a different style of leadership, and because each of them represented the entire county, the opportunity to work with council people who represent specific districts who have needs in their communities that need to be addressed, sometimes in very different ways, really challenged us. I know this is true across the county. I know it's particularly true in human services, to make sure that we were doing things in as universal a way as possible, no matter what we did. And so, you have caused us to question ourselves, I think, within the administration, about making sure that we're doing things in an efficient and effective manner. I mean, it's been a very good partnership, and I think especially last year's levy, which really did meet a need, as you all are well aware of, a need for some additional resources. And it took a lot of political courage and organization to get that levy passed. And while we've gotten pretty good at passing levies, asking for increases is very, very difficult. And without the political leadership that you all provided and the county executive, we wouldn't have gotten there. So I just want to, as a representative of the staff of the Human Services Department, I just wanted to thank you for your interest and your support and your questions. And we look forward to working with the next committee and the next council after January. So thank you very much.
Thank you, Rick, and you, and for everybody else in the administration. You've all been really great answering our questions and helping us with the learning curve, starting 4 years ago. And we appreciate all of that time that was put in to help us be able to make good decisions, completely aware that this work never ends and that there's always plenty of room for improvement. So thank you. I assume that there's no one here for comment.
No, Mr. Chair.
If there's nothing else, I can have a motion to adjourn the committee meeting.
So move.
Been moved and seconded. This committee is adjourned.